Good afternoon, students. Hope all are well. Today we discussed about bisphosphonates categories of drugs. Bisphosphonate, its name is also indicates bis, that is diphosphate. It is a class of drugs that prevents the loss of bone mass. So this bisphosphonates categories of drugs commonly prescribed for prevention and treatment of variety of skeletal conditions like bone metastasis, osteoporosis, Paget's disease. This bisphosphonates mainly inhibits hydroxyapatite breakdown, thereby effectively suppressing bone resorptions. This is the fundamental property of bisphosphonates, as leads to their utility as clinical agent. So its name indicates bis, the term indicating two phosphate groups attached a common carbon atom. These are structurally similar to natural pyrophosphate. This pyrophosphate is the natural analog of bisphosphonate, which is normal products of human metabolism that has a calcium chelating property. Next we come to this history of bisphosphonate. In 1897, von Baer and Hofmann reported the synthesis of first bisphosphonates. Initially used in chemical industry as anti-corrosive and anti-scaling agents by virtue of their ability to inhibit formation of calcium on surfaces. In 1916, Felix et al. First reported their ability to inhibit hydroxyapatite dissolution in bone. First human use of bisphosphate is etodornate was reported by Bisphosphonates et al. In 1969 for the prevention of myasthenia ossificans progressiva, that is MOP. This is an inherited disorder characterized by progressive fibrosis and ossification of muscles, tendons, ligaments of multiple size, etc. This is an inherited disorders. MOP, that is myasthenia ossificans progressiva. Smith et al. In 1971 were the first to report the evidence of effectiveness of bisphosphonates for the treatment of Paget's disease. Paget's disease is the mainly disrupts the replacement of old bone tissues with new bone tissues. This is Paget's disease. Bisphosphonates, these are the pyrophosphates analog. This is the natural analog of bisphosphonates, in which the oxygen in POP, that is the basic structural code of pyrophosphate, two phosphate groups and one oxygen. In bisphosphonate, this oxygen is replaced by carbon, then it becomes two phosphate and one carbon, PCP. This is the structural core of bisphosphonate. These are the different types of bisphosphonates. Is categorized as non-nitrogens and nitrogenous. This is nitrogen containing, and this is classified based on the presence or absence of nitrogen groups. Non-nitrogenous, that is etodornate, clodonate, telodornate. Nitrogenous are pimidornate, neridornate, olpadornate, alendronate, ibendronate, risidronate and solidronate. These are the main types of bisphosphonates. So basically there are two classes and they have different mechanism of action. Non-nitrogenous containing bisphosphonates, these are taken by the osteoclast and causes cell apoptosis through activation of capsase pathway. Capsase, that means is a family of protease enzyme playing essential role in programmed cell death, that includes apoptosis, paroptosis, neuroptosis and inflammations. So this mainly cause the activation of this capsase pathway in non-nitrogenous category. In nitrogen containing bisphosphonates are not metabolized and affect protein pyrylation of osteoclast by inhibiting farnesyl diphosphate synthase. This is the key enzyme of the Melnod pathway. We know this Melnod pathway, or is a HMG coenzyme reductase pathway. This is the important pathway in statins categories of drugs. Statins usually used for the cholesterol lowering drugs. So, this the Melnod pathway is also the important pathway in this cholesterol lowering drugs also. Here this nitrogen containing bisphosphonates is also inhibiting the farnesyl diphosphate synthase. This is the key enzyme of the Melnod pathway. These are the chemical structures of these different categories of bisphosphonate. These have a major role in their clinical activity. Structurally, bisphosphonates are chemically stable derivatives of pyrophosphate. It is a natural occurring compound. Here these two phosphate groups are linked by esterification. Like natural analog pyrophosphates, bisphosphonates have a very high affinity for bone mineral because they binds to hydroxyapatite crystals. So, these are the main different categories of bisphosphonates. Here this modification is applied to this chemical structure of bisphosphonates, and this modification mainly affects the effectiveness of bisphosphonate concentrations. So, this mainly needed for the anti-resorptive activity. So, core structure of bisphosphonates differs only slightly from pyrophosphates in that bisphosphonates contains a central non-hydrolysable carbon and a phosphate group flanking this central carbon are maintained. All bisphosphonates in current clinical use also has a hydroxyl groups. In some of these drug shows the hydroxyl groups. Hydroxyl groups attached to the central carbon atom. This termed as the R1 position. And this flanking phosphate groups provides bisphosphonates with a strong affinity for hydroxyapatite crystals in bonds and are also seen in pyrophosphates. This hydroxyl motifs further increases a bisphosphonate's ability to bind calcium. So, collectively this phosphate and hydroxyl groups create a tertiary rather than a binary interactions between the phosphates and bond matrix. These results bisphosphonates are remarkably specificity for bonds. These phosphate and hydroxyl groups are essential for bisphosphonates affinity for bond matrix. The final structural moiety, that is in R2 position, bound to the central carbon, is the primarily determinant of bisphosphonates potency for inhibition of bond resorption. Next come to the presence of nitrogen or amino groups role. The presence of nitrogen or amino groups usually increases the bisphosphonates anti-resorptive potency by 10 to 10,000 relative to early non-nitrogen containing bisphosphonates such as etodronate. Some of recent studies delineates the molecular mechanism by which nitrogen containing bisphosphonates inhibits osteoclast activity. In second and third generation bisphosphonates like alendronate, risedronate, ibendronate, pimidronate, solidronate, these have nitrogen containing R2 side chains. So, we summarize this: the presence of hydroxyl groups, nitrogen or amino groups. These are essential and this tells about the bisphosphonates affinity. Bisphosphonates have a two side chains R1, this affecting the binding affinity to bonds. R2 affects anti-resorptive capacity and possibly side effects profile. Bisphosphonates vary in potency based on these specific side chains. These are the different categories of bisphosphonates based on their structure. These categories does non-nitrogen bisphosphonates, alkyl amine bisphosphonates and heterocyclic nitrogen containing bisphosphonates. So, here this represents the mechanism of nitrogen containing bisphosphonates promotes osteoclast apoptosis is distinct from that of the non-nitrogen containing bisphosphonates. This nitrogen containing bisphosphonates binds to and inhibit the activity of farnesyl pyrophosphate synthase is a key regulatory enzyme in the melanoic acid pathway and is critical to the producing of the cholesterol and other sterols, isoprenoids, lipids, etc. As like this post-translation modification here occurs, that is isoprylation of proteins. This ultimately leading to the osteoclast apoptosis. Now, this farnesyl pyrophosphate synthase is ambiguously expressed in mammalian cells, has a critical role in lipid peroxidation, cellular apoptosis induced by nitrogen containing bisphosphonates appears to occur only in osteoclast. This is likely to direct functions of the ability of bisphosphonates to selectively adhere to and be retained within bone before endocytosis within osteoclast, during osteoclast mediated bone mineral dissolution and matrix digestion. So, here the summarize is nitrogen containing bisphosphonates inhibits farnesyl pyrophosphate synthase within osteoclast. So, this osteoclast endocytosis of bisphosphonates from the bone surface leads to farnesyl pyrophosphate inhibition and osteoclast apoptosis. Next come to this first generation oral bisphosphonates, that is ejodonate, medidonate, clodonate, toludonates. These are minimally modified side chains contains a chlorophenyl groups. So, all this metabolized into a non-hydrolysable ATP analog that accumulates within osteoclast and induce apoptosis, which account for its anti-resorptive effects. All this shows the least potent drugs. Second generation bisphosphonates, alendronate, pimidonate, ibandronate, this contains nitrogen groups, that is amino terminals in their third side chains. This primarily inhibits bone resorption. Its anti-resorptive activity involves inhibition of multiple steps in the pathway from melanoid to cholesterol and isoprenoid lipids that are required for prenylation of proteins that are important for osteoclast function. All these are 10 to 100 times more potent as comparing to first generation bisphosphonates. Next come to this third generation bisphosphonate, residonate and solidonate. This contains nitrogen atom within a heterocyclic ring. That is, this heterocyclic rings contains heteroatoms like nitrogen, oxygen or sulfur. So, here the nitrogen atoms within this heterocyclic ring. These are up to 10,000 times more potent than first generation. Let's come to this pharmacokinetics. Bisphosphonates are highly polar, poorly absorbed from GIT. A part of the absorbed drug is incorporated into bone and remains for long from months to years. The free drug is excreted unchanged in urine. Solidonate is less irritant to the veins. It is administered once in a year. So, mechanism of bisphosphonates. Bisphosphonates are used to inhibit bone resorption and they act through different mode of action. First one is the inhibit development of osteoclast, and the one is induction of osteoclast apoptosis, and the one is reduction of osteoclast activity. Next is the prevention of development of osteoclast from hematopoietic causes. And the one is the stimulation of production of an osteoclast inhibitory factor. These are the main mechanism of action of bisphosphonates. Uses in case of Paget's disease of bone, etodonate treatment of choice of Paget's disease, they reduce bone pain and decrease alkaline phosphate levels. For prevention and treatment of postmenopausal osteoporosis, these bisphosphonates drugs improve bone mineral density and reduce incidence of vertebral fracture. Another use to prevent corticosteroids induced osteoporosis along with oral calcium carbonate. Another use in case of hypercalcemia of malignancy, bisphosphonates control hypercalcemia by inhibiting bone resorption. Solidonate is the most potent and is the drug of choice for malignant hypercalcemia. These bisphosphonates are also useful to control hypercalcemia of hyperparathyroidism and is helpful to relieve the pain of lytic bone lesions. Etodonate is the first bisphosphonates to be used clinically in hypercalcemia and Paget's disease, administered both orally and IV, but not preferred now. Dose 5 to 7.5 mg per kilogram per day. Solidonate is the drug of choice for hypercalcemia and alendronate, risedronate for Paget's disease. This is etodonate disodium is a synthetic therapeutic diphosphate analog of endogenous pyrophosphate. These agents adsorbs to hydroxyapatite cells and reduce the number of osteoclasts, thereby inhibiting abnormal bone resorption. Etodonate may also directly stimulate bone formation by osteoblasts. A diphosphate which affects calcium metabolism. It inhibits ectopic calcification and slows down bone resorptions and bone turnover. Uses: this etodonate is used to treat a certain type of bone disease called Paget's disease. This disease weakens and deforms bones. Etodonate works by slowing bone loss, helping to keep your bone strong and less likely to break. It also helps reduce bone pain from this disease. Etodonate is also used to prevent or treat bone problems that may occur after hip replacement therapy, surgery or spinal cord injury. Pemidonate is a second generation potent bisphosphonates administered only by IV infusion in a dose of 60 to 90 mg over 2 to 4 hours weekly or monthly depending on this condition. It is used in Paget's disease, hypercalcemia of malignancy, bony metastasis. Adverse effects are thrombophlebitis of injected vein, bone pain, fever, leukopenia, flu-like reactions. Alendronate is a potent, orally effective second generation amino bisphosphonate used for prevention and treatment of osteoporosis both in men and women as well as Paget's disease. It is to be taken on empty stomach in the morning with full glass of water, and patient is instructed not to lie down or take food for at least 30 minutes. These measurements are needed to prevent esophagitis. These are the drug interactions. This shows the drug interactions with calcium, iron, antacids, tea, coffee, fruit juice and NSAIDs. These are the adverse reactions: gastric ulcers, flattency, headache, body pain, initial fall in serum calcium level. Next drug is risedronate. Is the oral third generation bisphosphonates, more potent than alendronate. It is indicated in treatment of osteoporosis and Paget's disease. Dose 35 mg weekly oral in the morning with full glass of water. Next is solidonate. Is highly potent third generation bisphosphonate. It is indicated for hypercalcemia, bony metastasis, osteolytic lesions, Paget's disease. Solidonate 4 mg infused IV once every 12 months has been used for osteoporosis in postmenopausal women who do not tolerate oral alendronate or risedronate. These are the adverse effects: nausea, vomiting, diarrhea, heartburn, esophagitis, peptic ulcer, fever, myalgia, hypercalcemia, headache, skin rashes. Oral bisphosphonates should be taken with plenty of water and the patient should remain upright for at least 30 minutes to prevent esophagitis. Flu-like symptoms can occur on parenteral administration. Rarely, osteonecrosis of jaw may occur, especially with solitornate. Thank you. Thank you for your patient listening.